Good morning and welcome to the 2020 MCC annual meeting. This is the first time in over 20 years that the annual meeting has been held virtually. I wish we could all be together, but I'm hoping that today's conference provides an opportunity to connect, learn, and strengthen the Michigan Cancer Consortium. My name is Deb Doherty, and I am one of the MCC co-chairs. I would like to extend a special welcome to those of you attending the MCC event for the first time. We are so glad that you are here. We hope that you enjoy your day, learn more about the Michigan Cancer Consortium, and continue to participate in our activities. Our conference theme this year is Joining Forces, Michigan Programs Addressing Cultural Humility and Health Disparities. The program committee has worked very hard to bring us topics to increase our knowledge on inclusion and health equity and highlight programs that are working to make change in the state of Michigan. The educational opportunities offered through this meeting will help us to build on our previous work. It is my hope that MCC organizations will continue to develop skills and leave with resources for the communities that you serve. Our conference goals are to create opportunities to, number one, learn about cultural humility and the programs active in Michigan. Number two, focus on the work to reduce health disparities. And number three, engage in the future of Michigan Cancer Consortium. So let's get started. It is now my honor to present our first award, the MCC Inspiration Award. Honoring a cancer survivor reminds each of us how important our work is. We had many wonderful nominations this year, so congratulations to everyone that was nominated. It is wonderful to see the amazing outreach and advocacy done by survivors in Michigan. The MCC Inspiration Award reminds us that no one should face cancer alone. Courageous, determined, resolute, faithful, these are the faces of cancer survivors. These nominees exemplify significant participation in community cancer events, outstanding leadership, along with empowerment to other cancer survivors and advocates. So it is my great honor today to announce that our 2020 MCC Inspiration Award recipient is Amanda Crowell Itliong. Amanda has a background in leadership and education, but refocused her efforts to advance patient advocacy. She works tirelessly on behalf of ovarian cancer patients and is always generous with her time and energy despite her own personal health challenges. She demonstrates her patient advocacy passion through her writing, speaking, and service with organizations such as the Survivors Teaching Students and the American College of Radiology. Amanda was a pioneer on the inaugural Millennial Trains project with her work, Sick and, which researched the shared identity of chronic illness. She has been a storyteller for The Moth and a speaker advocate for Healthcare Voter and Priorities USA. Despite several relapses with her cancer, Amanda has worked over the past several years to help design a comprehensive curriculum entitled Education, Alliance, Solace, and Empowerment to complement ovarian cancer patients' care and management. In this unique program, patients starting treatment within a similar time period of diagnosis will begin group appointments together. Amanda helped create this innovative program with Michigan medicine faculty, wrote a grant, and received funding from the Michigan Ovarian Cancer Alliance. In addition, Amanda is a loyal, engaged member of the Michigan Oncology Quality Consortium's Patient and Caregiver Quality Oncology Council. This allows her voice to be heard by over 90% of the medical oncologists in the state of Michigan. Her role includes participating in regional and biannual meetings, where she shares in meaningful ways the perspective of a cancer survivor with physicians and practice leadership. Her direct and honest presentations have assisted membership to see improvements in care through the eyes of a patient. Consequently, practices have actually adjusted their approaches using her insights, which result in more patient-centric activities. She is a daily inspiration. So congratulations to Amanda, the 2020 MCC Inspiration Award recipient. Lots of clapping is happening, Amanda. And at this time, I would like to invite Amanda to take a few minutes to share her story with us. Amanda?
Thank you so much, Deborah, and thank you to everybody at MCC. It's great to be here with you this morning. Thanks first to my parents, who are the best caregivers. They're the ones who instilled in me the value of service to others. Thanks to my boyfriend, Patrick, who helped me to stay positive, even through my biggest challenges. And to my doggy, Bieber, who gives me joy every day. I hope everybody has somebody like that in their life. I'm so lucky to have friends and family who have loved and supported me through the 12 years and 4 times that I've had ovarian cancer so far. Thanks so much to the organizations that I get to volunteer with and learn from. MOXIE, the Michigan Oncology Quality Consortium, is so amazing. Louise, Dr. Griggs, Vanessa, and the whole team always inspire me because of our shared commitment to data-driven improvement and cancer patients from all backgrounds. MIOCA, the Michigan Ovarian Cancer Alliance, has given me opportunities to fundraise for research and raise awareness of ovarian cancer. And thanks to STS, Survivors Teaching Students, for the opportunity to teach healthcare students and professionals about ovarian cancer, and for the special friends that I've made there. Thanks so much to the American College of Radiology team, who gives me so many learning opportunities as we work together to make radiology more patient-friendly. I'm also thankful for Emmerman Angels, who's connected me to amazing mentees over the years. 3 other organizations have had such a positive impact on my life with cancer, and I just wanted to mention them because they're great things to refer cancer patients to. First Descents taught me how to whitewater kayak in Montana when I was still pretty sick, and I hope you'll recommend it to all patients under 40 for an awesome opportunity to challenge themselves. Gilda's Club is such a loving community in Metro Detroit, and Reeling and Healing, which taught me to fly fish, can help women across our state to build a new skill while bonding through cancer. Huge thanks to my doctors, nurses, PAs, MAs, and all the techs, especially at my gynecological oncologist office at St. Joe's Ann Arbor with Dr. Rebecca Liu, Dr. Brandy Michaels, and nurse practitioner Nicole Brashear. They keep me as healthy as possible so that I can enjoy my life and contribute to the cancer community. They heal patients with their super smarts, their encouragement, and their love. My message to all of you today is to think of patients as partners. We come to you with an illness, but also with skills, talents, and experiences that can be very helpful to your work and your goals. We can and should be included in all parts of the planning, execution, and evaluation of your services and programming. I spent my career before disability teaching university students. My specialty was helping nerds save the world, so I'm used to working with awesome people like all of you. Public speaking, writing, and curriculum planning have always been in my wheelhouse, and my biggest highlight as a patient advocate over the years so far has been getting to collaborate with my beloved gynecologic oncologist, Dr. Rebecca Liu, and nurse practitioner, Nicole Brashear. We've been able to create a supportive educational program together to help women just diagnosed with ovarian cancer. It's called EASE, which stands for Education, Alliance, Solace, and Empowerment. My medical collaborators provide the expertise and knowledge of ovarian cancer and its treatment, while as a 12-year survivor with a teaching background, I bring the patient tips, the personal development reflections, and the fun activities. Together, we've created an informative and engaging opportunity for women to build connections and deepen their understanding of their own disease. I'm still currently in treatment and living with cancer. It slows me down for sure, but it gives me up-to-the-minute insight into the cancer experience. Please don't forget to include us. Some of us will never get the opportunity to live beyond cancer, so we'd love the chance to help others while we're not dead yet. Thanks so much to MCC for this award. I'm so honored and humbled. It means so much to be recognized by the state that I love for doing things that I love to help others. I'm so inspired by our cancer community, and I know that we can continue to accomplish amazing things together. Thank you.
Thank you, Amanda, for your truly inspirational story, and thank you for sharing it and all that you do on behalf of the entire community involved in cancer care. It is now my honor to present the MCC Awards. The first will be the 2020 Spirit of Collaboration Awards. These awards recognize projects that exemplify the spirit of the Michigan Cancer Consortium, which is collaboration. This award is one of my favorite parts of the annual meeting. It's wonderful to learn about the collaboration around the state and the organizations that are making that happen. The projects honored today represent outstanding collaborations that are consistent with the objectives and strategies of our comprehensive cancer control plan in Michigan. The one organization has earned a Spirit of Collaboration honorable mention, and that is the colorectal cancer screening project at the Men's Health event, September 2020. The collaborating partners are listed here: the American Cancer Society, Michigan Institute of Urology, Men's Health Foundation, Beaumont Health, St. Mary's Livonia, and the Henry Ford Cancer Institute. And I just want to acknowledge these organizations for the great work they've done on the colorectal cancer screening project that took place at the Men's Health event. So thank you very much, and congratulations to these organizations. It is now my pleasure to introduce the 2020 MCC Spirit of Collaboration Award winners. Our first project is Reducing Barriers to Access of Psychosocial Support. The project is a collaboration of St. Joseph's Mercy Cancer Centers and the cancer support community. St. Joseph Mercy Health Centers and cancer support community have worked together closely since the concept of bringing a cancer support center to the region was first envisioned. Since CSS opened in 2007, St. Joe's Mercy Cancer Centers has referred thousands of patients for services to the CSS. For the past several years, the CSS and SJMHS have expanded this partnership, whereby CSS formally became a part of the psychosocial support programming offered to the patients and families treated at SJMHS sites. As such, a comprehensive psychosocial program is currently offered in Canton, Chelsea, Brighton, and Ann Arbor. This includes support groups, exercise classes, mindfulness meditation, educational workshops, and a full-time oncology therapist. As a result of this partnership, patients and family members in rural communities have access to the same high-quality cancer support services that are available in some of our more urban areas. Since the development of this partnership, the CSC provides support services to over 500 individuals receiving treatment at the St. Joseph Mercy Cancer Centers to amplify the support services available to their patients under the guidance of the Commission on Cancer. Accepting the Spirit of Collaboration Award is Bonnie Dockham. Bonnie, would you like to say a few words about your wonderful collaborative project?
I would like to just start with thanking the Michigan Cancer Consortium for this really meaningful award. I'm so thrilled to accept this on behalf of the cancer support community of Greater Ann Arbor. And as you mentioned, the cancer support community has worked really closely with St. Joseph Mercy Cancer Centers for several years since the development of our initial nonprofit in 2007. And since that time, our work has really morphed to become more and more meaningful to serve the needs of the patients and caregivers in our community. St. Joseph Mercy Cancer Center, the leadership really cares deeply about the needs of their patients and caregivers and thinks innovatively about how to meet their needs. This program partnership really was developed out of those conversations. Being able to collaborate and focus on our areas of expertise allows both organizations to meet our mission and goals while saving money, allowing for professional focus, and assisting meeting the needs of patients and family members, as well as the requirements on the Commission on Cancer. As you mentioned, we have programs now in collaboration in the Brighton, Canton, Chelsea, and Ann Arbor area. Some of those areas where these services were not only scarce, but some of them non-existent altogether. These comprehensive psychosocial programs take management, oversight, and significant resources, and to work together, this meaningful partnership has allowed us to serve thousands and thousands of people over the years. There has been a theme today that I've noticed. I was in the COVID breakout session, and there was a theme around the emotional support needs as it relates to anxiety and distress, depression, and isolation, particularly in the world that we're living in now with COVID. Because of our partnership, we've been able to continue serving those patients and caregivers receiving their care at St. Joseph Mercy Health System. We've transitioned all of our programs online to a virtual format, and we've actually seen a 31% increase in service provision through these virtual programs. So as we know, these needs don't go away as social distancing continues, and we are just so thrilled that we're able to partner with St. Joseph Mercy Cancer Centers and the leadership there to make sure that no one faces cancer alone. So thank you for the acknowledgement, recognition, and we're really truly honored and proud to work together.
So thank you very much on behalf of our organization. Our second Spirit of Collaboration Award goes to Carmanos Cancer Institute, Office of Cancer Health Equity and Community Engagement, or OCHCE. The Research and Advocacy Consortium, RAC, a community-based collaborative spearheaded by OCHCE, is a growing network of community partners, including faith-based, social service, public health, and cultural organizations. There are currently close to 40 community stakeholder organizations working together with OCHECE and Carmanos Cancer Institute scientists to support evidence-based interventions to improve cancer outcomes, inform diverse communities about clinical trials, cancer control, prevention, screening, treatment, aid in the dissemination and implementation of research discoveries, and support cancer-relevant health practices and policy recommendations to address social determinants of cancer care. And this is so important, especially in our current times. Additionally, the OCHECE coordinates with groups of cancer survivors, caregivers, and advocates who use their local expertise and influence within the community to inform a cancer research agenda and deliver cancer-relevant education. So truly an important component of our cancer delivery. Accepting the Spirit of Collaboration Award is Noel Larkin. And Noel, would you like to say a few words about your wonderful collaborative project?
Yes, thank you so much. Again, it's my honor to accept this award today on behalf of Carmanos Cancer Institute's Office of Cancer Health Equity and Community Engagement. I just want to first acknowledge our committed and hardworking staff. I don't think I've ever worked with such a group of kind, creative, hardworking individuals. Dr. Haley Thompson's our faculty lead and associate center director for community outreach and engagement. It's my list of other staff: Von Seal Brown Miller, Shoma Paul, Carrie Francis, Ann Katz, Sheena Cresswell, Brittany Dow, Asha Freeman, Dr. Truman Hudson, Forrest Hosey, Chris Johns, Lazina Tapchu, and Emel Adolphus. So we often talk about our collaborators or our partners as grassroots or grass tops. And these are kind of terms rooted in community organizing. So as Dana mentioned, our grass top partners are from our Research and Advocacy Consortium. Again, we have a network of 40 community partners. And we just want to thank our consortium members for their hard work and contributions working with our office to support these interventions, inform diverse communities about research and clinical trials, and help communicate advocacy efforts. And by grassroots partners, we're really talking about our Cancer Action Council members. We have around 90 members right now who are patients, caregivers, survivors, and advocates who use their local expertise to develop a research agenda and come up with research questions and partner with researchers. Many of our Cancer Action Council members have been meeting since 2016, and we just really appreciate their knowledge, passion, leadership. It's really been core to our success the last 4 years, and we're continually impressed with their flexibility and perseverance. You know, for example, when our work went remote last March, we were really able to transfer all 8 groups over to virtual Zoom meetings without missing a beat. Their work continued, and many of these council members, this was the first time they'd used some of these types of platforms. And finally, I just want to thank our academic research partners who have truly embraced our vision and have worked with us to show that community engaged research can truly lead to better science. Our Cancer Action Councils and organizational partners and researchers are working together to explore and address a variety of cancer control and prevention issues. And lastly, we invite you, to join us in this work. Please reach out to me or Haley Thompson or any of our staff if you want to join in our research efforts or partnerships or programs. So we know the cancer care arm of McLaren now, our partners and collaborations span across the state and in our 46 county catchment area. So thank you so much, and we appreciate the award.
Thank you, Noel, for that wonderful summary, and we really congratulate you and your team. It truly takes a large group of individuals who are hardworking and dedicated like you are to really make a difference for all our patients. And I just want to thank all the Spirit of Collaboration winners for your innovation, creativity, commitment, and hard work for cancer control in Michigan. We honor and celebrate your collaborative spirit, and we are delighted to be part of your village that makes all this possible. So thank you again. And now I turn the podium over to my co-chair, Deb Doherty, who will move on to present a very important award, and I'll let her fill you in. Thank you so much, everyone.
Thank you, Dana. It is now time to present the MCC Champion Award. This award honors an individual that is associated with the MCC who has demonstrated leadership, excellence, success, and impact in the fight against cancer. It is a true honor to be nominated for this award, to be recognized for your work in cancer prevention and control. And now it is my pleasure to announce that Dr. Susan Hoppough is the recipient of the 2020 Michigan Cancer Consortium Champion Award. Let me tell you a little bit about Susan. Dr. Susan Hoppough just retired as the Executive Director of Research and Innovation for Mercy Health, including St. Mary's and Mercy Health Partners in Muskegon. She graduated from Michigan State University with a master's in nursing and a PhD in family studies, specializing in underserved populations. Dr. Hoppough has been a leader and long-standing member of the Michigan Cancer Consortium. She has used her extensive experience and expertise to benefit cancer prevention and control initiatives as performed through many of the MCC committees and work groups. Her leadership also consisted of serving on the MCC Board of Directors and serving as an MCC co-chair. During her time as co-chair of the MCC, Dr. Hoppough represented the consortium at a national coalition workshop and was on hand to accept a national award from Sea Change for work to reduce tobacco use among cancer survivors. With over 20 years of experience in research, Dr. Hoppough provided operational oversight of contracts and grants for both federally funded programs and research, including clinical trials and investigator-initiated studies. At the national level, Dr. Hoppough was the Disparities Subcommittee co-chair for the NCI National Community Cancer Center program, to which the Lax Cancer Center of St. Mary's was selected in 2010. She also co-led the Disparities Subcommittee for this program locally. Dr. Hoppough is a leader in the cancer prevention and control initiatives through her work with Mercy Health, the Michigan Cancer Consortium, Susan G. Komen, as well as other national and local organizations who are addressing cancer disparities. Congratulations, Susan, on receiving the 2020 MCC Champion Award. It is so well deserved. Susan, would you like to say a few words?
I don't even know what to begin to say, except that I am so grateful for this honor. What an honor. A highlight of my career has been working with the Michigan Cancer Consortium, and the fact that the time has gone so quickly is in some ways frightening, but the journey continues and the work continues, and I'm so to have been, it's not finished. I know that in my time we will now be a political activist to add the care for those underserved. I think those things are as we move forward. So I attending now. I'm attending a watercolor workshop, part of my new retirement journey, is also to engage in those kinds of things that spark joy. But truly in my life, being a member of the Michigan Cancer Consortium and being with all of you in this journey have been a highlight of my career. I am humbled, I am honored, I live in gratitude for each and every one of you. All of you that I've worked with have touched my life and left an impression on me. And I thank you for your patience, your mentorship, and the joy that you bring to the lives of those that you serve. So thank you very much.
Thank you. Good afternoon, and congratulations to our award winners. This is such a wonderful virtual setting to honor collaboration and leadership. It is always humbling to hear the amazing work that is occurring in our state. My name is Polly Hager. I'm the Cancer Prevention and Control Section Manager at the Michigan Department of Health and Human Services. Our staff support the programs and activities of the Michigan Cancer Consortium. Today is the rollout of the Michigan Cancer Plan for 2021 to 2030. This is a cancer plan for Michigan. It's for MCC members and anyone wanting to address cancer in our state. Let's start with the executive summary. It's a great overview of why the plan is needed and what's in the plan. You can see there are 5 goal areas, 52 objectives, and 145 strategies. Next, let's move to the health equity section. This is a new goal and section of the plan. I want to point out the disparity spotlight you see in the lower right corner. Please watch for the disparity spotlight as you move to each goal in the plan. The strategies that you see are evidence-based. This provides a firm foundation for our organizations and partners to implement the interventions. So what else is new in the plan this year? You may have noticed it's a 10-year plan. This gives us more time to implement objectives and strategies. The plan also aligns with Healthy People 2030 to keep Michigan in sync with work at the national level and around the country. The format and user-friendly display of data is another feature of the new cancer plan that I think all readers will enjoy. What can MCC member organizations do? Review the cancer plan. Please review it all the way through and then share it within your organization and the communities you serve. Remember, this is Michigan's cancer plan. Commit to be active in the consortium. Participate in the upcoming MCC work group and select an objective or strategy to actively work on within your organization. And then, as we prepare to end the meeting today, I want to be sure to thank the MCC Annual Meeting Program Committee for organizing our day. We enjoyed the highest quality of speakers today and timely topics. Thank you. Well, that ends our meeting for today, and I want to say thank you again and give you best wishes for your health and safety throughout the year.